5 questions you should ask when you go for scan. Now, pregnant women, when you go for scan, most times you don't really understand the result that you are giving. Now, these are the 5 questions you should ask your sonographer anytime you go for an ultrasound scan. Very important. It not only make you know how your baby is doing, it also show that you are knowledgeable about your pregnancy. The first question is, ask for the fetal heartbeat. That is the heartbeat of the baby, and know the range. The normal heartbeat of the baby should be between 130 to 160 beats per minute. So the heartbeat of your child will be shown to you, and they will even show you the oscillation of the heart. That is the rising and the dropping of the heart. They will also show you on the screen. So make sure you ask. The second question you should ask is the position of your placenta. Your placenta can be either anterior or posterior, but it should not be low lying. Your placenta should be high. So if your placenta is low, you will be told. If it's anterior or posterior, you will also be told. So make sure you ask. The third question is, ask of the amniotic fluid. You know, as a baby is growing, that fluid that cushions the baby in the womb also grows. So it grows according to the age of the baby. So ask for the adequacy of the fluid. If the fluid is adequate, you will also be told. Another thing you should ask for is the general well-being of the baby. If there's any abnormality, if there's anything to raise eyebrows, you will also be told. You will check for fetal anomalies, check for anything or fetal defect, check for if there is anything wrong with that pregnancy. You will also be told. The fifth one is, ask for the age of the pregnancy and compare it with your last menstrual period, because sometimes the scan will give you a range plus and minus 2 weeks. So when the scan gives you a range, you now check it with your last menstrual period to know the day you are expected to deliver. So all these questions are very important, and asking for the weeks or the age of your pregnancy, as your gestational age, is very important, because it will also tell you if the pregnancy is progressing or not. So then the sixth one is now when you now ask for gender. Gender is irrelevant. Only if you want to find out for the baby, you want to buy your baby things. But gender is not the main thing for going for a scan. These 5 questions are very important to know that the baby is doing fine. So the next time you go for a scan, make sure you ask these 5 questions so that they will know that you know what's up.